Hello, Professor Matula, and thank you so much for being such a great host for us here in Vienna for the Neurotrauma Treatment Simulation Center. If you could please tell us a few words about yourself, including your area of research and practice.
Well, first of all, thank you very much for coming and join us. It's a pleasure having you all here. Well, as you know, I'm one of the gray eminences here in Vienna, so I'm working here for a very long time. Myself, beneath the fact that I'm the vice chair here from the whole department, I'm the director of the skull base unit and the director of the Neurotrauma Center here in Vienna. And I'm very proud of that, very proud having a wonderful team working together with me. Vienna is not only a great city, it's in the center of Europe. We are working in the General Hospital of Vienna, which is one of the biggest hospitals in Europe. We have around 2,500 beds here. We have around 14,000 people working in that hospital, including around 2,500 doctors. So it's really a city in the city. And we are very proud of our institutions. We are treating patients not only from Austria, but from all over the world. That makes us very proud. And our main philosophy, what we are doing here, is we have a strict focus on interdisciplinary work. So we are a multidisciplinary institution. And well, I'm a neurosurgeon from my heart. I always used to say I'm a bloody surgeon. I'm a simple medical hand worker, and I'm very proud of that.
What was your motivation for taking such a good lead in this coordinating team for the program?
Well, there is one easy answer for that, because I truly believe in that. I truly believe in that because this is the way into a great future. I think this is the way for the next steps, especially for the young generation. Together we are strong for our patients. And if we work together, then this is the best benefit our patients can have. And definitely that will improve outcome.
Could you describe how your experience shaped your opinion regarding the treatment of neurotrauma?
Well, first of all, experience is something that takes a while, you know. Experience you can't get with a click in a minute. And the shapeness, especially in terms of neurotrauma, are those unbelievable variety of cases we are confronted with. So neurotrauma is something we are confronted day by day. That things can happen to any one of us at any time, in any place. And dealing with that type of patients, you have to be flexible. You have to have a great empathy what's going on. And actually you have to prepare to do something what some people may say, you never can do that. You can.
Are you familiar with similar programs running at the moment, like the one we are in right now?
The NTSC Vienna project is worldwide unique. So the Neurotrauma Center Vienna is something we created in a lot of conversations we had before. It's based on competence and driven by excellence. Means we have been lucky to bring the right people together. And so the Neurotrauma Center, the Neurotrauma Simulation Center, to be correct, is something worldwide unique, and we are very proud of that.
If you had to identify the main challenges in the approach of TBI in the current times, which three of these would be on top?
That has changed over the years. And if you listen to my talks today, the expectations of the patient from the past have been simply survive, no matter how. The expectations of the patients of the present is, I call it the McDonald's surgery. It means they come in like to be treated immediately and like to leave the hospital at once, sometimes even without paying. And the expectations from the patients for the future will be optimized. They like to come within the hospital, they like to be treated immediately, and they like to be much better afterwards than before. They like to be optimized. And this is one of the major tasks for the future, because the patient's expectations are very high. In terms of neurotrauma, for the future, we definitely should focus on motor recovery and depression. More than about three quarters of the patients will get a depression after trauma. This is an enormous high number. This is a big group of people, so we have to work on that. And motor function recovery is something what the people really need in their daily life. So these are two focuses which we have to take seriously in our mind.
Okay. Regarding the treatment and rehabilitation process for patients suffering from neurotrauma, which organizational issues do you consider to be most pressing?
Oh, that sounds like an easy question with so much difficult answers, because the answers goes in many directions. For my profession, I'm a neurosurgeon. Doing a perfect neurosurgical work, this is no more enough. This is just one part of the story. If you look on the whole workflow of neurotrauma, beginning the trauma, the first response, the first line rescue chain, the transportation to the centers, treatment within the centers, no matter if it's just conservative or surgically, the aftercare, follow-up, rehabilitation, and reintegration in their normal life and work. If just one part of that chain is failing, then all the work is done. So a chain is that strong as its weakest link. And we have to, if we really like to cover the whole neurotrauma portfolio, then we have to have a look at all that stuff. And that includes, of course, rehabilitation, which is a very important part of the program. But it includes also prevention. Don't forget prevention, because it shouldn't come to that sometimes often terrible accidents. A good example is wearing helmets. That has changed the landscape, the neurotrauma landscape.
From your point of view, which are the main limitations in the approach of cognitive, behavioral, or depressive disorders resulting from neurotrauma?
This is a good question and not easy to answer. But I will try. What are the limitations? The limitations are, in terms of severe trauma, the morphological damage. Unfortunately, if big parts of the brain are damaged, this is a true limitation. Another limitation is the not adequate aftercare and follow-up situation. So, the treatment for trauma doesn't stop by removing an epidural. It goes much more after that. So this is what I mentioned before. Once again, you have to have an eye on the whole chain, what's going on. And once again, a chain is as that strong as its weakest link. And you have to take care that that chain has really strong links.
Could you describe one of the most complex or intriguing cases of neurotrauma in your career so far? There are many, of course. There is one that I'd stand out from the rest.
I will honestly answer your question. As you know, we as neurosurgeons, we are confronted mostly with the real severe parts of neurotrauma. So we know that about 90% of trauma are mild to moderate traumas, okay? Which is the biggest number of patients, but mostly these are not that spectacular ones. I remember a case I did with a young woman about 30, 35 years old from age, picking up her kids from the kindergarten, driving her car, and she has to stop because of a light, and beneath her, her ex-husband was stopping and shoot her with a pump gun. And she was brought to our institution, more dead than alive. And I had a big fight with the chief from our trauma department because I said, this is a young woman. And if she has just the minimum of a chance, we have to give her that chance. And I remember very good, all the posterior fossa was blown away. And I operated on her for about 20 hours. And so I removed, I counted it, I removed 62 bullets out of her head and her upper cervical spine. And we had to reconstruct everything from the bone. And I have pictures of that where I have the last bullet directly at the brainstem. And at that moment, I was also not sure how that will end up. Today, she has a normal life. It's not only that she survived, it's not only that she is a wonderful mother bringing up her kids, she's also very successful in her job. She survived without any deficits, and that makes me really proud. And this is also one of my simple philosophies. Never give up.
This is so interesting. The next questions will be very boring after that. Online communities in the medical field are becoming more and more visible. Considering this, what do you think of the role of online communities in the medical practice?
Because we are confronted with that pandemic, at the beginning of the pandemic, I think this was a good thing to do. So it brought the people together, although they haven't had the chance. Now I have to say that most of the people are sick because of that. So if I look on the participants, they have enough of that. So they prefer the really face-to-face meetings. What they want are not the big meetings, they like the smaller ones, they like the direct communication, they like the direct conversation. So, to your question, I think in principle it's a very good thing. In principle it goes very quickly. This is the new style. But at the end of the day, it's not that beneficial and not that efficient as a really good face-to-face meeting.
From your perspectives, which are the obstacles that would affect a proper long-term follow-up of patients?
I would say in the workflow, unfortunately, the success of medical research in neurotrauma was not really that much successful in the last decades. Now we are happy to have good working substances which are influencing the long-term outcome. And I think this is a very good hope for the future. So there is light at the horizon coming up. And I'm just following that light. I think all the things we have additionally to our surgical work, to our initial work for neurotrauma, which goes far beyond that, are very helpful. So the add-on therapy, the medications for a long run are very, very useful, and I think they are very beneficial for the patients.
Our last question is related to COVID-19, and we want to ask, how do you consider it impacted the management of neurotrauma?
Yes, probably my answer will surprise you, because my feeling, working in one of the biggest hospitals, involved in all that stuff, it doesn't have had that big effect or that big influence, because trauma happens with or without COVID-19. So if you ask me, is the number of cases decreasing because COVID? I don't have the feeling. Probably the landscape is a little different. In Austria, the people are crazy driving their motorcycles and riding their mountain bikes and going skiing, in particular skiing. During the pandemic, that has changed. The falls have become more, the problems within the family internally have become more. Unfortunately, the suicide rate become more. So eventually the landscape has changed a little bit, but not the number.
Thank you very much.
It's my pleasure.
It was really nice to talk to you, and it was nice that you had the time to give us this interview.
It was my honor having you here. It was my honor having you as guests here. So you are welcome to come back again whenever you want. And thank you for asking me those questions.